Hi, everyone. Welcome to the Ovation Show, where we're discussing the healthcare crisis in America. We're bringing partners, colleagues, clients, and business owners together to discuss solutions and innovations that bring a higher quality of care to employees, reduce their out-of-pocket costs, but also reducing the employer costs and giving them more transparency and control. Today, we're live in Work Innovators studio, where Work Innovators is amplifying the voice of business at the VentureX in Castle Hills at the Realm. Today, my guest is Gary Becker from ScriptSourcing. Gary, welcome to the show.
Thanks for having me, Dan.
Thanks for coming in from Baltimore. Big trip, and appreciate you being here.
My pleasure.
So we're working with ScriptSourcing as a solution for our clients. And for those that don't know ScriptSourcing, tell me a little bit about what is ScriptSourcing?
Well, ScriptSourcing really is a risk management company and a technology company, a solution company that makes available $0 copays for many maintenance name brand meds and specialty meds. And we're saving plan members monies, and we're saving on average over 70 cents on the dollar for plan sponsors.
Oh, wow. So are you a PBM?
We are not a PBM. We are a solution provider. We supplement what's available through PBMs.
Okay, so PBM, for those that don't know, it's a pharmacy benefit manager. So a lot of the big ones like Optum, Express Scripts, CVS Caremark. But now we're working a lot with, we talk a lot about fiduciary and transparent PBMs or pharmacy benefit managers. Do you work with the big, they control 80% of the market, those big three. Are you working with them, or do you work more with the smaller PBMs?
We're capable of working with any PBM, but the PBMs that are most receptive to working with us are those PBMs whose interests are aligned not with their shareholders, but the plan sponsors they're doing business with. These are PBMs that are really interested in helping plan members procure meds at the lowest possible net cost without these hidden cash flows. These big PBMs are making a lot of money, and they know how to have hidden cash flows and perform very well financially. The three biggest PBMs are Fortune 25 companies.
Right. I think they have like 80% of the market as well. So, but I would think that them having that control, they should be getting us the lowest cost and the best drugs at the lowest cost, shouldn't they?
You would think that, when I grew up, nobody ever got fired for hiring IBM. Bigger is better. What we've learned is that isn't the case. And we really are trying to promote PBMs that have a fiduciary responsibility to the plan sponsor and its members. And that's about 3% of the PBMs out there are behaving in a way that really aligns their interests with the plan sponsor.
Okay, so let's take a back step a little bit. So if I'm an employee and I'm getting a drug and maybe I have a copay, and you're saying you can get that drug for no copay, how does that work? Let's kind of walk through that process.
Well, we have a variety of solutions, but with the PBMs that we work with, we are getting data, and we are able to identify the 8 to 10% of the scripts that are eligible for our services. And when we identify these members who are taking these medications, we engage them. Sometimes they engage us, and we let them know that they have the opportunity to use our services, and we can source medications on their behalf, typically a 90-day supply for a $0 copay. And it's very simple. Enrollment takes typically under 5 minutes.
Oh, wow.
And it's a win-win. And what we found is that medication non-adherence is a big deal. Dickinson College was one of our first clients. And when I went up to Carlisle, Pennsylvania to meet with the employees, teachers were coming up to me saying, Gary, I'm taking 3, 4, 5 medications. Our copay's $35, and I'm pill skipping. And that's the first time I experienced what I read about, that medication non-adherence is a big deal. And 1/3 of hospitalizations are due to medication non-adherence.
Yeah, I think, in fact, the chapter I just wrote for the book that's coming out in January, we talk about that. I think it's 80% of America has at least one chronic condition. And then, again, hospitalizations come from non-adherence medications. People die because they can't get their medications because they can't afford it, whether it's a high copay, or I think we're also in a realm of everyone's doing high deductible health plans. You've got these big deductibles. I'm paying 100% for my drug, and it's $500. I can't afford to take it anymore. So you're getting employees their drugs at no cost. Where are you getting the drugs from?
Well, we have several solutions. One of our popular solutions is our international pharmacy program. So what's going on is here in the United States, the same exact medications that are available in these tier 1 countries, Canada, United Kingdom, Australia, New Zealand, these medications are 2 to 10 times more expensive in the United States. These medications are factory packaged and sealed at the same manufacturer, and they're simply sourced through brick and mortar pharmacies with real life pharmacists that happen to be in Canada or United Kingdom, Australia, New Zealand. They're shipped right to plan members for a $0 copay.
So why are the drugs so much cheaper overseas in Canada? I mean, why do you think?
Well, the United States is the richest country out there, and we are subsidizing the rest of the world. So it's a combination of, we have PBM industry and the pharmaceutical industry, and they are profiteering here in the United States.
So the employee gets their drug, they're getting it for free. So I'm assuming you're getting it at a lower cost. So how does that help the employer?
So there are medications, for example, Tecfidera. That's a multiple sclerosis med. Here in the United States, it was $80,000 for several years old. I blanked and now it's $100,000. Okay, that medication can be sourced internationally for less than half the cost.
Oh, wow. So, that's a good, using that as an example. I know we have one of our clients, in fact, it was one of the first clients we placed with you. And the first drug we got through was Humira. And that employee was taking, I don't know how many boxes it was, but it was $10,000 a month. And so $120,000 to the plan, or $120,000. And you guys came in, got it for the employee at no cost, and pulled that $120,000 off the employer's claims, which of course makes them really happy. We've seen that quite a bit. What are some of the most popular drugs you're seeing?
Well, let's talk about Humira first. So the typical dosage for Humira is 2 pens a month. And about 6 years ago, the cost was about $25,000 a year if you were taking 2 pens per month. And about 3-4 years ago, it was $52,000 a year. Today, it's $70,000 a year for Humira. The dosage you're referring to, there's some people who need 4 pens. So it's now, instead of costing $70,000, it's $140,000. And the solution that you're referring to is we have we call the program MAP, our Manufacturer Assistance Program. But there's over $8 billion of monies available to help folks who are lower paid, based on their household income, based on their household size. So we know how to tap into the assistance that's available to help employers better manage their prescription spend.
Okay. And we talked about, again, you're getting, I guess, the PBM notifies you, tells you you've got these drugs coming through, you're looking at that. What's the pathway? So you reach out to the employee, you reach out to the employer?
Well, so what's happening is with the PBMs that we prefer to do business with, we have created both a clinical and a financial authorization process. So what's important is, there's some PBMs out there that they approve almost every specialty medication because it's in their financial best interest to do that. The honest PBMs that are out there are clinically managing prescription spend. So if somebody is prescribed Humira, maybe there's a less expensive medication that's appropriate with the same efficacy. So if the medication is clinically appropriate, then we're in sync with the PBM. They notify us, and we have a non-disruptive, highly integrated solution in which the member can receive their medications while we apply for assistance, or if assistance isn't available, we research the international pharmacy opportunities so we can source these medications at the lowest possible net cost.
And so you said you're getting the drugs like Canada, UK, Mexico?
Well, not Mexico.
Okay. So when you're getting from overseas, you said, same packaging, same boxing. Are there regulations the same as the US? Or they?
Yeah, so these are tier 1 countries. And a tier 1 country is a country deemed by our Congress to have the same or higher standards as our FDA here. So they have, the same types of, oversight, and requirements here as the United States.
So what's the reaction when you call an employee and you say, hey, we can do this drug? Are they skeptical? Do you have a little convincing, or does the employee say, no, I'm really interested, I want to know more?
Well, there's 3 types of employees. There's those that are early adopters, eventual adopters, and there's some folks that are non-adopters. So if we had the opportunity to talk to a plan member, ultimately they are to do what is in their and their family's best interest. We will source the medication. It's typically a 90-day supply for a $0 copay. If they give it a try, they're going to get their meds for free. It's going to be shipped right to their doorstep. And I don't know if we've ever had a member say, no, thank you. I appreciate the free meds you've been sending over to us, but we're going to go back to our corner pharmacy and start paying our copay again. There are some folks that would prefer, they have relationships with their pharmacists, or they just would prefer to keep doing things the way they have. Maybe they don't value the savings in the copay. But what so many folks are recognizing is that in healthcare, we're all in it together. And to the extent that an employee can save some money on Humira or Tecfidera or whatever the medication is, it helps reduce the employer's healthcare spend, which ultimately means lower premiums for everybody.
I think you hit something there too. We're looking at the employee's out-of-pocket cost on drugs, but when you look at the overall health plan, and you're in risk management, that's what you do. So you look at if you can reduce those costs, reduce the employer's cost. Now the employees hopefully can not get an increase this year, reduce what they're contributing out of their premium. So it works all the way around. Talk a little bit about some of the risk management you do when you look at a group. We were talking about that yesterday.
So, our focus has been on name brand and specialty medications. And what we have realized and what we've learned is that 1% to 3% of plan members are driving 30 to 50% of the spend. Okay, so if we can provide solutions that address this 1% to 3%, employers will have high performing health plans. So when we work with benefit consultants like Dan Labroad, we request a detailed prescription report. And we're able to take in all this data and within 24 hours provide an output so you can see the medications that we're capable of helping with and the savings that we could potentially deliver.
So when you do that, what's the average savings you're seeing? Is there a certain percentage that you're seeing overall? Or does it kind of vary just depending on the group?
It does vary. Specialty meds, by year 2000, well, first of all, specialty meds are 1% of the scripts. That's now about 50% of the prescription spend. And the way things are trending with medications, medication costs by 2025 will be 50% of the healthcare costs. That's what's happening. In terms of our savings, it does vary from employer to employer, but on average, the medications that we're able to help with, we're saving over 70 cents on the dollar.
Okay. So, and I do like you mentioned your analysis where you look at the RX spend. That was one of the things in the very beginning I loved, because we send that data over and you come back with that report, and we can take that to an employer, or an employer can look at it themselves and see the actual costs that they could possibly save. And they're big numbers. We do the same thing working with the PBMs, the fiduciary PBMs.
This is low-hanging fruit. Yep. There are employers, if they could save that $60,000 on Tecfidera or $120,000 on Humira, that's another employee. That's that's a 401k contribution that they wouldn't otherwise make. It's a big deal for a lot of employers. So
I know we just did another group and we sent over the pharmacy two drugs for one person going through some treatments, and I think it was about $260,000 was the expected spend, and you guys got the drug for free for him. And so that was again great for the health plan. It really helps, and of course the stop loss carriers love that too. Another discussion we were talking about going into back to the PBMs now. You mentioned, of course, they've got financial incentive built in there. What are some of the ways you see the PBMs making money, I guess, off of the clients, off the employers?
Well, the two main areas is rebates we're hearing a lot about. So many PBMs are keeping all or most of the rebate revenue. The more honest PBMs don't keep a nickel of rebate revenue. It all goes to the employer. And another area is something called spread pricing. So interestingly, if a plan member goes to a pharmacy and they're buying their generic med, and maybe the generic med costs $30, the health plan is being charged $80. Well, why is the health plan being charged $80 for a $30 medication?
Yeah.
You know why? Because they're allowed to. Because in their contract says we're allowed to charge a spread. So they're making a lot of money there.
So eliminating all of that, we talk about fiduciary, transparent PBMs. They're eliminating all of that. They take all that out and they're just getting a fee per script.
One source of revenue, okay? Typically a script fee. Okay. So they make the same amount of money on a $10 med as a $10,000 med. They don't own the specialty pharmacy. There's no conflicts of interest. They are acting, their interests are aligned with the employer, which is important.
So where do you see, I guess looking down the road, and we look at the commercials every day on TV. There's always new drugs coming out. Where do you see your business going? I don't know, is there anything new coming up?
I can tell you more money is research and development. There's more money being spent on specialty medications because that's the most profitable to the pharmaceutical industry. So I believe, our solutions will become more and more important for employers when they start seeing these large bills for the treatment of their plan members.
Okay. We're going to be right back. We'll take a break and hear from our sponsor, and we'll continue with Gary from ScriptSourcing.
Employers turn to TBX to provide a modern, seamless, and hassle-free self-enrollment experience for core and voluntary products aimed at educating, not selling to employees. In fact, not only can employers provide a user-friendly, mobile responsive technology solution full of dynamic communications, professional videos, and a data-driven decision support tool, they can do so at no cost to them. That's right. With TBX, there are no setup fees or PEPMs, and there's no need to replace existing technology, as we can easily snap onto any existing HRIS and HCM systems. Plus, the enrollment experience is ready in just 30 to 45 days or less, and data files are properly formatted and delivered to carrier and payroll destinations quickly, securely, and accurately. We look forward to helping you accomplish what others can't. A state-of-the-art technology platform for open enrollment, new hires, and qualified life event processing that's simple to implement and maintain. A partnership that's a perfect fit. That's TBX.
And we are back, and today I've got Gary Becker, CEO of ScriptSourcing, in the studio, and we're going to continue our conversation on basically sourcing medications and controlling risk in the drug spend of employers' companies, as well as for the employees and reducing their costs. So Gary, great to have you here again.
Thanks, Dan.
So we were talking about controlling costs, and we did talk about getting rid of copay, saving employees money, and then even the cost savings for the employer, what we can do with your program and a fiduciary PBM, which is a hot topic now. I wanted to bring up, one of the clients we got in the last year, we got that client because of pharmacy consulting and going in. It said low-hanging fruit. They didn't want to change their broker, but they wanted to reduce their overall spend. So we came in, you just talked about doing that analysis. And so yourself, did an analysis. We had USRX Care, one of our fiduciary PBMs we used to do it. And we presented them with about a 40% cost savings expected. And so we implemented both your programs. You guys were doing great things. Renzo did great things at USRX Care. And we just finished that 12 months. What I wanted to tell you was, we expected about 42% savings. But between the two of you, they reduced their costs 72% in the first year. Wow. They went from over $300,000 spend down to like 88. And they've actually filled more drugs than they did previously. And they don't have much turnover, so it was the same drugs they were getting before. We just reduced that cost. But that was a huge savings. I mean, it was something I didn't expect. I was thinking 40, 50, so 72 was amazing, and they were blown away. So you got what you're doing works, and we know that. Do you have any other case studies or something else you could share with us? That's a smaller group, 70 employees, but you got some larger cases too.
Sure, we have a lot of great stories. One story that comes to mind is a municipality in Georgia with about 1,200 employees. And they had $1 million deficit. And when you're a municipality and you have $1 million deficit, you have two choices, cut services or raise taxes. That's it. So they took a leap of faith and they decided to work with one of our fiduciary PBM partners. They decided to work with ScriptSourcing. And at the end of the day, the net savings was $1.5 million. So they ended up having a surplus where they were struggling with the deficit that they had. And they've been a client of ours since 2017. So since then, they've saved over $3 million, maybe $3.6 million. So it's been a great success story for them.
That makes a big impact. You and I were talking last night about putting money back into the health plan or saving money and what that can do. And we were talking about private equity groups and EBITDA and how they're trying to boost profitability. But talk a little bit about, if I save $600,000, what does that do if I'm trying to sell a company, buy a company? What does that impact?
So there are companies, there are employers out there that are looking to exit. And when we can go in there and save $600,000, like you mentioned, and the company's going to be sold at 10 times, a multiple of 10 times their profit, their EBITDA, a $600,000 savings equates to a $6 million in the pocket of the owners. So, as a benefit consultant, it's nice to be able to say that, we can save you $600,000 with our solutions, but to be able to say that, we can put $6 million in your pocket, that's a really big deal. And I think it's an advanced sales approach.
So Gary, we're talking about increasing EBITDA and putting money back in the bottom line. But of course, you've got to get paid as well. So how do you get paid? Because you're basically taking money out of the bottom line to pay yourself. How do you guys get paid?
So our arrangement, we don't charge an admin fee. We don't charge a setup fee, a technology fee. We're solely performance-based compensation. So to the extent that our solutions are successful, the employers, our clients, keep 75% of the savings. So we work collaboratively. We sit on the same side of the table, and we're basically partners, and we work jointly to achieve a great outcome.
So they're only paying you if your services are utilized and successful.
If we don't deliver savings, or if it takes us a little while to deliver savings, we don't get paid.
Oh, that's excellent. One of the things we go to technology now, because you guys are doing a lot with technology as well. Can you kind of just elaborate on that? Tell me about that.
We've made a huge investment in technology, and we have a customized Salesforce program, and we're getting data from many PBMs, and we have a technology that allows us to identify these members. We get data every single day, really. So we're able to identify those members who are taking meds eligible for our services. We are engaging. We have a program that sends emails out to our clients every single month and says, these are the folks that are eligible for our services. So our clients can promote us, but we also ask for phone numbers and email addresses. We're not going to wait for our phone to ring. So we will continuously call, email folks that are eligible for our services. And we've had a lot of success. We have many member advocates that are doing this all day.
Okay, and that's good, I think, because you can't just sit back and wait for an employee to think they need you and they don't even know, or they might not even know you exist.
Sure.
So reaching out to them.
As a matter of fact, we have online, we have a med finder link. So folks can go online and look at the medications. They could type in the medication that maybe they've recently been prescribed, and they can see, whether we can make that med available to them or not for zero copay. They can also go online and click a button and get on our calendars. So we make it very simple.
I like that. In fact, it just made me think we should put the med finder link on our benefits technology. Mm-hmm. So when the employee's in there enrolling, looking at their benefits online, they could have that link actually readily available to remind them. So I like that. What kind of communications are you, so you said you're getting emails, phone numbers for the employees. So what kind of communications are you doing to the employees or sending them to reach out, to have that outreach, to get them engaged?
So we have a director of marketing, Julie Black, and we have much collateral, new collateral. So we want to be fresh. And so just promoting the zero copay solutions that we have, promoting these MedFinder links, promoting our phone number and how to get on our calendar. So we have lots of means to, promote our solutions.
So what are the first steps? So if I'm an employer and I want to save money, mm-hmm. and I want to take care of my employees, which is the big thing. We're trying to do two things. We're trying to save money, make our health plan better, and take care of our employees. As an employer, what is my next step, or what are the steps I have to take to get this done?
Well, we work through benefit consultants. So if there's an employer interested in our services, you talk to the benefit consultant, and typically we'll get some data and we'll provide your proposal and show you what the opportunity is. And I just want to share, we're kind of like a security system with our technology, in that you might have a group, we only work with self-funded clients, but you might have the healthiest group out there. Nobody takes any name brand meds. That's fine. So there's no engagement. But we're going to monitor claims. And at some point, someone's going to get prescribed that Humira or any of these medications we can help with. And at that moment, we can engage that member. So we're not going to wait until renewal time after you've just spent $60,000 or $120,000 on a medication. We're going to be very proactive. And that kind of sets us apart from other folks that are doing similar things in the marketplace.
So reach out to benefit brokers, consultants, you're working in self-funded plans. Is there a certain type of, broker, consultant that you find tends to work with you more than others? Certain mentality maybe, or?
Well, like a lot of things, there's some misaligned interests out there. And the larger big box agencies, they make money through the PBM contracts. They make money keeping folks with maybe TPAs where there's some hidden cash flows to them. And they're not our ideal benefit consultants to this point, So we're working with proactive, innovative benefit consultants who truly want to be disruptors in the marketplace. And, there's more work when you're working with the ScriptSourcing, when you're working with these other solution providers, it's a lot more work for benefit consultants, but it delivers outcomes. So, what a lot of our benefit consultants ask employers is like, what are you looking for in a benefit consultant? Are you looking for activity or are you looking for outcomes? Because if you want outcomes, we deliver quantifiable and measurable outcomes. We're different than maybe the big box agencies that are out there.
And I think that's the model that we go after. You talk about performance-based. We want, as a consultant, we want to get paid as performance. We want to go out there and give outcomes so that they're comfortable paying us. And I know as a broker, our clients stay with us because of the outcomes we're having. We don't have to worry each year if we're going to lose that account because we're not doing our job. We bring in those outcomes, and solutions like yours are a big key piece of that.
I'll give you a quick example. Like several years ago, one of the plan members was prescribed Harvoni. It's a hepatitis C medication. At the time, it was $90,000 for a 3-month supply. You take the medications, you follow the doctor's orders, and you're cured of hepatitis C. It's unbelievable and very expensive. And we applied for assistance to get this medication at no cost, and we were denied. So we reapplied, we appealed, and we were denied again. We reapplied 5 times and they finally approved us. Okay, so I don't know if they approved us because we got in touch with the right person, or they were sick and tired of us. But it's a great story because when we only get paid if we perform, I can promise you, if I was getting a fee whether I performed or not, I would have quit after the second time. Okay, but I thought the member qualified. We were persistent, and eventually, we had success with this member.
I love all the success stories. I mean, we've seen it. You've got it. You've been doing this for a long time. So what I'm getting, we've got employers saving money, reducing their costs. Win for the employees. They are having no co-pays, getting their drugs for free, shipped directly to their house. It's a win. Have you done any, something that came up, I know we were talking about this before, like international tourism? I've heard people getting sent places to get drugs.
There was a time that we were doing that. We were sending folks to beautiful destinations to receive their medications at a much lower cost. But really, we've had these medications that were only available through tourism are now available through mail order. There's better shipping containers, FDA approved heat and cold sensitive containers that can ship the medications. And sometimes it's a bit of a challenge to ask somebody to travel to, to the Cayman Islands, for example. To travel there 3-4 times a year is a big ask. It's much easier just to ship the medication. So we're open to solutions that work, that deliver savings, but we're open to the solutions that deliver the most savings at the least amount of disruption.
This is awesome. I mean, we're real excited to work with ScriptSourcing. We've been doing it for years now. Our clients are real happy. So I think it's just a great add-on. And again, it's something we can just strap onto a current plan. So I think kind of the steps that we've taken is, number one, we need the pharmacy claims from the client, send them to you, and we'll find a PBM, analyze them, see what savings are available there. And then really it's just at that point strapping it on and implementing it and reaching out to the employees. Yeah,
it's really non-disruptive for plan members and for the employer to make a change in the PBM, which isn't required, but I highly recommend it. It's a simple solution. It's a simple transition. It really is.
This is awesome.
You have your medical card. Instead of having one logo, you have a different logo in your card. Folks can go to the same 63,000 pharmacies across the country.
Awesome. Well, Gary, this has been great having you in. For anyone out there that is interested in ScriptSourcing or is a self-funded plan and you really want to take control of that pharmacy spend, contact Gary at ScriptSourcing.com. You can reach out to me. We'll be happy to help you and do the analysis. And look forward to talking with you. Thanks, Gary, for coming in.
Thank you, Dan.
Appreciate it. We want to give special thanks to our sponsors, Craig Shelley, Luxury Watches of Beverly Hills, Success North Dallas, where Bill Wallace has been connecting people for over 30 years, and of course, Work Innovators, that is amplifying the voice of business. We appreciate everyone coming out here, and have a great time. We'll see you later.